Are you a woman over 30, contemplating pregnancy, or actively trying to conceive? This video is specifically designed for you, offering crucial insights into your fertility journey. Subscribe now to unlock vital information and support for this significant life stage. Welcome to Fertility After 30, what every woman needs to know before it's too late. Understanding your reproductive health is not just important, it's absolutely crucial as you meticulously plan for your future family and navigate the path to parenthood. Many women today are making the conscious choice to start families later in life, a decision that brings with it both unique joys and specific considerations, particularly concerning their fertility and reproductive timelines. The concept of the biological clock is widely recognized, and it is indeed a fundamental truth that female fertility naturally experiences a decline with advancing age, a process that begins earlier than many might realize. Women are born with a finite and non-renewable number of eggs, and both the quantity and the overall quality of these eggs inevitably diminish over the course of time, impacting reproductive potential. At the time of birth, a female possesses an impressive approximate count of 1 to 2 million eggs. However, by the age of 30, a significant reduction occurs, with only about 12% of these maximum pre-birth oocytes remaining, highlighting a substantial decrease. This reduction in egg count continues progressively, with only about 3% remaining by the age of 40. This accelerated decline significantly impacts the chances of natural conception, making it more challenging as time progresses. Beyond the mere quantity, the quality of eggs also experiences a decline with age. Older eggs are inherently more prone to chromosomal abnormalities, which can lead to increased difficulties in conceiving and maintaining a pregnancy. These chromosomal abnormalities in older eggs also unfortunately increase the risk of miscarriage, which can be emotionally devastating and contribute to a higher incidence of genetic disorders in any potential offspring. Female fertility begins its gradual decline in the early 30s, a process that then undergoes a more accelerated and noticeable drop after a woman reaches the age of 35, making timing a critical factor. By the age of 40, the statistical chance of getting pregnant in any given monthly cycle is significantly reduced to approximately 5%, underscoring the impact of age on natural conception rates. While the impact of female age on fertility is frequently discussed, it's equally important to acknowledge that male fertility also experiences a decline, typically commencing around 40 to 45 years of age. Research indicates that older fathers have an increased risk of their children developing certain mental health and developmental disorders, adding another layer of consideration to family planning discussions. So, the crucial question arises, when should you consider seeking a fertility evaluation? It is strongly recommended if you are 30 or older and are actively considering pregnancy in the near future. If you are 35 or older and have been diligently trying to conceive for 6 months without success, it is a clear indicator that it's time to consult with a fertility specialist for further assessment and guidance. For those under 35, an evaluation is generally advised if you have been trying to conceive for a full 12 months without achieving pregnancy, suggesting a need for professional insight. Other important indicators for seeking a fertility evaluation include experiencing irregular menstrual cycles, having a history of recurrent miscarriages, or prior pelvic infections, all of which can impact fertility. Additionally, if there is a family history of early menopause, it warrants a proactive fertility assessment to understand your own reproductive timeline and potential risks. Several key fertility tests are readily available for women to assess their reproductive health. The anti-Müllerian hormone, or AMH, test is a crucial blood test that measures ovarian reserve, providing insight into your egg supply. This simple blood test provides a valuable indication of the number of eggs remaining in your ovaries and helps medical professionals assess how your ovaries might respond to potential fertility treatments. A Day 3 hormonal panel, which is conducted early in the menstrual cycle, checks key hormone levels such as FSH, LH, and estradiol, providing critical insights into your cycle's progression and ovarian function. A pelvic ultrasound is a non-invasive imaging technique that thoroughly examines the uterus and ovaries for any structural abnormalities, such as fibroids or cysts, which could impede conception. This ultrasound also plays a vital role in calculating the antral follicle count, which directly indicates the number of small follicles and thus potential eggs available in a given menstrual cycle. Hysterosalpingogram, or HSG, and sonohysterogram are specialized tests designed to assess the uterine cavity for any abnormalities and, crucially, to check if the fallopian tubes are open and clear. These essential tests ensure that the egg and sperm can physically meet within the fallopian tubes and that a fertilized embryo can successfully implant into the uterine wall, a critical step for pregnancy. Beyond medical interventions, adopting a healthy lifestyle can profoundly and positively impact fertility, even when facing age-related declines, offering a proactive approach to reproductive well-being. Maintaining a healthy weight is absolutely crucial for fertility, as being either overweight or underweight can significantly disrupt ovulation patterns and throw off delicate hormone balances essential for conception. A balanced diet, generously rich in fresh fruits, vibrant vegetables, wholesome whole grains, and lean proteins, actively supports optimal hormone balance and provides essential nutrients vital for reproductive health. Key nutrients such as folic acid, zinc, and a variety of antioxidants are particularly important for supporting and enhancing fertility, playing crucial roles in egg health and reproductive function. Regular, moderate physical activity helps to regulate hormones and maintain a healthy weight, both beneficial for fertility. However, it is important to avoid overexercising, which can sometimes have a counterproductive effect. High stress levels have been scientifically shown to negatively affect fertility by disrupting hormonal balance. Incorporating techniques like meditation, yoga, and deep breathing can effectively help manage and reduce stress. It's also vitally important to completely avoid smoking and to significantly limit alcohol consumption, as both habits are strongly linked to lower fertility rates and can hinder conception efforts. Moderate caffeine intake, specifically less than 200 milligrams per day, which is roughly equivalent to 1 to 2 small cups of coffee, appears to have a minimal impact on overall fertility. Finally, ensuring adequate sleep is absolutely essential, as a consistent lack of sleep can negatively affect hormone production, which is critical for fertility. Aim for a restorative 7 to 9 hours per night. For women over 30 who are facing fertility challenges, it is reassuring to know that several effective and advanced treatment options are readily available to help them achieve their family-building dreams. Intrauterine insemination, or IUI, is a procedure that involves carefully placing specially prepared sperm directly into the uterus during the woman's ovulation period, increasing the chances of fertilization. This IUI procedure is often strategically combined with fertility medications, which are prescribed to stimulate the ovaries and encourage the production of multiple healthy eggs, further enhancing success rates. In vitro fertilization, or IVF, represents a more complex and advanced reproductive procedure where eggs are meticulously retrieved from the ovaries and then fertilized with sperm in a controlled laboratory environment. Following successful fertilization and initial embryo development in the lab, the resulting embryos are then carefully transferred into the woman's uterus with the hope of successful implantation and pregnancy. IVF success rates exhibit significant variability, largely depending on the woman's age. Women under 35 generally experience the highest success rates due to better egg quality and quantity. Conversely, women over 40 who undergo IVF typically experience significantly lower success rates, underscoring the impact of age on the effectiveness of this fertility treatment. Pre-implantation genetic testing, or PGT, is an advanced screening test that meticulously identifies embryos with genetic disorders or chromosomal abnormalities before they are implanted into the uterus. This sophisticated testing can significantly improve IVF outcomes by allowing for the careful selection and transfer of only the healthiest and most viable embryos, thereby increasing the chances of a successful pregnancy. Egg freezing, also known as oocyte cryopreservation, is a groundbreaking process that involves extracting, carefully freezing, and then storing a woman's eggs for future use, offering a proactive approach to fertility preservation. This innovative procedure effectively preserves a woman's reproductive potential, providing invaluable flexibility in her family planning timeline and allowing her to delay childbearing without compromising her chances. The American Society for Reproductive Medicine, a leading authority, suggests that the best chance of achieving a successful pregnancy from frozen eggs comes from those frozen before a woman reaches the age of 38. Vitrification, an innovative flash freezing technique, has revolutionized egg freezing by significantly reducing the risk of damage to the eggs during both the freezing and subsequent thawing processes, improving viability. For women facing challenges such as poor egg quality or diminished ovarian reserve, utilizing donor eggs from a younger woman can significantly increase their chances of achieving a successful pregnancy and a healthy baby. While fertility after 30 certainly presents its unique set of challenges and considerations, it is entirely possible and achievable to conceive and carry a healthy pregnancy to term with the right knowledge and support. Understanding the various factors that affect fertility, proactively adopting a healthy lifestyle, and seeking timely medical evaluation and treatment are all absolutely key components for success. These crucial steps collectively empower women to make well-informed decisions about their reproductive health and significantly increase their chances of successfully achieving their cherished family-building goals. Thank you for watching Fertility After 30, what every woman needs to know before it's too late. We hope this information has been enlightening and empowering for your journey. If you found this information valuable and helpful, please take a moment to subscribe to our channel for more informative videos on women's health, fertility, and family planning. Your support helps us create more content.